Thanks for staying with us. So the federal government reintroduced a nationwide 12 a.m. to 4 a.m. curfew to curtail the further spread of COVID-19. Many Nigerians are questioning the rationale behind the shutting down of businesses and restrictions on social and religious gatherings. What are your thoughts on this? You can call us on 0812-7053687. You can also call us on 091-390-76948. You can tweet us at TVC Connect. Please hashtag your view TVC so we can read your tweets. All right, so this is hot because we've seen what's happening in India. We're afraid if the government knows something they're not telling us, or if we might have a situation at hand that they're trying to manage, or they're just really truthfully being preventive. No, we're not sure which it is, but either way, we've all been guilty of complacency on the issue of adhering to the guidelines, and I think it's important for us to bring it back to the fore and to begin to discuss how we can social distance and continue this adherence. But many, someone like Shrine took for a long time.
Shut down.
They shut down for so long and they adhered to the rules so strictly. And now that you're just gradually trying to restart,
open up again.
They are telling us to move back. So, I don't even know where to start from working. But generally, what are your thoughts when you heard about these new restrictions?
I said they have come again. That was my first. Because first and foremost, as far as I know, the restrictions have never been removed. As far as I know that the 12 to 4 a.m. curfew has been there. Because if you're out, you will see police. By 5 minutes to 12, you see police waiting for you to so that they can arrest you.
Wow.
I have seen it. Not that they told me, I have seen it. So that 12 a.m. curfew was. So why are they saying, oh, we're just starting it? Now, states took the decision on their own to allow, because they can see what it's doing economically to their states. Because remember when Okonjo-Iweala said our GDP was what it was then? It's from the work of everybody. It's not from the government. It's, now what they're doing is they're killing the GDP. They're killing the small businesses. One, two, they're not helping them to grow after the killing. You're just saying close down. I don't care how you eat. At least show that, okay, if you are closed down, I have a, because I'm not. I went to Abeokuta at the weekend and I was in the market and I saw all the women there. They were not wearing masks. I was wearing my mask. You wear your mask and you look like a stranger. You look like an alien. Everybody just looking at you. I want a coat deal, you know.
Yeah.
So I said to them, I said, nobody is wearing mask here. I said to one of them, she says, Kosiko Rombi. That's how everybody thinks. Enlightenment. Keep telling people. I will say it forever. If you do not inform, then you don't have any mouth to talk. If you don't tell me, I know because I read and I watch the news. A lot of people don't.
Yeah, but I don't know.
So if you're informing people, say, look, this corona is real. Show me example. So people will be encouraged to wear masks.
So the good news is that we're not locking down yet. They've not locked down. All they're saying is reintroducing the restriction because they had actually relaxed it for a while, saying that we can go ahead.
They had never relaxed it. It was the states
that took that decision.
Yes.
Okay, so for me, I think that we need to protect ourselves. We're seeing what's happening in India, and we should be careful as a nation. But I don't think that the right approach is to lock people, to say that, to create a policy that would have no impact. Because it will seem like talk shop. You see, when you cry foul, 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 the day you are serious, people don't take you serious. Yeah. So you say there's restriction, but we see that there's really no restriction. We say that we're following COVID guidelines, but we see some people that are above. They are the VIP class, and they escape. They gather crowd. There's a public video of the gathering of the crowd without nose mask, and they don't get penalized. So at the end of the day, it's more like, okay, you have started again, continue. The impact of partial lockdown, the impact of no parties, the impact of no social gathering affects many people. The clubs feed people. They pay salaries. The bars help people, that the ripple effect goes far. So when you say bars should lock down, it means people cannot hang out. It means that...
That's where I hear you. I was saying that.
Yes.
But let's be careful.
Let's be careful.
No, Mariah,
India had that same situation.
Yes.
And right
What
now,
We're
they are
not
there.
India, please.
Well, that was what they thought too.
That's what they thought.
So what I want to say is, following up on what YK has said, how well have we implemented COVID compliance? Are we using our nose masks? Are we mandating people to social distance?
Okay, so let me respond to that for a second, because I'm not speaking on behalf of the government. There's only so much they can do. The government cannot put a gun down your head and say, please wear a face mask. So it's still us, the people, that must respond. They can tell us, remind us, reintroduce it in any way they want to do. But if we don't do it as a people, it's not going to happen. And listen, the point is that I think also, as much as we like to say, don't shut down the economy, don't do this, don't do that. But if, God forbid, this thing happens such that we now have another third wave, there will be really no economy for us.
Okay,
so it's being preventive, and I think part of our role here is also to remind Nigerians of how important it is for us to begin to adhere to these guidelines.
So according to stats, Nigeria has so far recorded 165,419 cases of the virus, out of which 2,000 have died, while 156,000 have been discharged.
On record.
On record. So if you see the numbers we have compared to the 200 and something million that we have, I think there is no cause for alarm. I've always said this, that we do not know how long this virus is going to be here. We need to start learning to live with the virus, to live with it, to handle our businesses with it. There are countries that did not even have one lockdown, and they were able to come out of it. Countries like Switzerland, not one lockdown, and they were able to come out of it. So instead of locking down today, people are struggling, there's hunger in the land, businesses are not thriving. Those people who finally came out of the lockdown are just finding ways to stand up. You now introduce another partial, whether you call it partial or not, it's affecting businesses. We have a lot of insecurity in the land. That insecurity was even made more open and more, when we had COVID-19, because people had no jobs, and they had to the criminals had to resort to the stealing, the kidnapping, and all of that. You lock us back in, we are going to implode.
So let's be very careful. It's not a lockdown.
Yes.
I don't want us to run.
Whether it's a partial, no, they said clubs are not allowed to open. There were some.
It's a gathering.
Yes,
so
the
bars,
bars are not allowed to open.
But I think they still allow the 50% capacity. I think based on what I've seen.
And we're not even sure, because some are saying 50%, some are saying 50 people.
Yes.
So we're not even sure whether some...
So it's the
transportation. So the transportation that we had, they said 50% capacity. We knew how that was biting Nigerians, because the transport fares had to increase. We have issues of fuel price right now, and the fact that the bus drivers were asked to carry just 50%. So I think we should enforce everywhere you go. Every organization, every establishment must have their water to wash hands, their sanitizers. You must have your face masks. We should have face masks for free, not asking people to pay 500 naira, somebody that has not eaten, to be able to wear face masks. Have it everywhere you go. If we can enforce this, and the fact that some of us have taken the vaccines already, we'll find a way to live with this virus.
Face mask is 100 naira. It's not 500 naira anyway.
I'm just saying, there are some establishments you go to and they collect 500 naira to
I'm happy you brought up the vaccine, because this vaccine that you're talking about, you brought inside a country of 200 million, you brought 4 million. Now you're saying you can't even give the whole 4 million because India
that gave it to you.
That gave it to you have said they're not giving you again. So you're not even taking steps to bring vaccine. America, they have vaccinated about 3/4 of the population in America now. Here, you have vaccinated less than 4 million people. Hey, are you calling yourself serious?
I think, again, I'm not here to speak of the government, because they're here to bring the government to come and speak to us. But the truth is that I know there are steps being taken, even within Lagos. I know the government of Lagos is trying to see it. I can even speak directly to some of these manufacturers to bring in for citizens. But either way, I think it's important for us to remind ourselves that there's only so much the government can do. At the end of the day, responsibility comes to us to social distance, reduce our outings. There's a time that we're not going to parties. It's now that, so we've all relaxed. We're now looking for. We've gone to party. Let us not try. We've not gone to party. I've gone to party.
Me, I've not gone. I did not see party.
So, Mariah,
I've help you. I haven't seen party now.
So the point is that reminding you and I that this is our going out. This thing can still come, because whether we like it or not, God forbid somebody comes in from these areas that are quite that are having this issue right now, comes into Nigeria. God forbid, it's going to be crazy. We don't have our medical system is already weakened. It will further weaken it.
I agree with you. I agree with everything you said. But please, don't you think that's why I say implementation? India, they did it. I was surprised when they did it. They banned flights from India, Brazil, Turkey. Yes,
They were even flogging their citizens. Remember, they were flogging their citizens. Wasn't it?
Nigeria banned
them from coming in. Yes.
those
The papers
flights from
had
coming
it.
in, which I thought was totally acceptable.
Yes.
Because I would have done that. Now, you have to make sure that
They
good
don't
people
come
that
through
make sure that the person from India is not coming through
Another-
China
Oh,
or
yeah.
Or the
Japan.
borders.
You know,
The land borders.
just make sure so that those people are kept at bay. That's number one. Number two, if there is something that they know that we don't know,
Maybe somebody has even come in already.
tell us.
should tell
If the
us.
variant is here already,
Let us know.
tell us.
Yeah.
Don't hide it.
Nigerians, the less you know, the better. Let me go on a break. We'll be right back. I beg, if I were you.
Stay tuned. Your view will be right back.
Thanks for staying with us. So we had to call Dr. Japhet because when we hear government saying all these things, Dr. Japhet, we know he's our own. So we'll find out from
He
him.
will tell us the truth.
Dr. Japhet, are you there? Hello, Dr. Japhet, are you there?
I am here with you. Good morning.
Good morning. Good
Good
to have you.
morning.
You see, when it comes to COVID
Yeah,
matters,
good morning.
we can always know that you will tell us, please,
Yeah, go to.
what is it that the government is seeing that we are not seeing? Is there something that is happening that you are not telling us concerning this COVID matter?
Is variant here?
Yes, so.
And it is due to what is happening all over the world, actually. I think the government is just trying to be proactive instead of reactive. So that is what is going on. We have new variants in some countries. We have increased social mixing everywhere now. Relaxation of the public health and social preventive measures all over the world now. And then some people have not received the vaccine. A lot of people have not received the vaccine. So some countries have what we call a third wave or a fourth wave. And then because of that, a lot of people are getting the infection afresh because they have relaxed public health preventive measures. So I think the federal government is just trying to prevent that from happening here, because if you look around, you will see that our people have a lot of people have stopped wearing their face masks. A lot of people have stopped using hand sanitizer. I can't even say that health workers are left out. We have all let our gaps now, and then I think government is just trying to prevent what is happening in places like India from happening here. That's why the new measures are out.
All right.
So what other measures are they looking to adopt aside from the partial lockdown? Is there any plan to sensitize people the more? Because if you go to especially the rural areas, they've forgotten anything about face masks. They don't even care anymore. Is there any plan in that regard?
Yes, I agree with you. Not even just the rural areas, the urban centers. A lot of people are not wearing their face masks. But be that as it may, you would agree with me that in Nigeria, you cannot enter a bank, some government facilities without wearing your face mask.
Yes.
So wearing face mask actually helps us a lot in Nigeria to lower our infection rate. So compared to some other countries where you would just have the mask and the hand sanitizer there, and it was optional, places like Ireland or UK, a lot of people, even in the US, a lot of them refuse to wear the face mask. And then that's why you see what is happening over there happening. No matter what, the limited number of people that wear the face mask, the rate at which they are spreading the infection here is reduced. Now, the federal government is also planning to roll out rapid test kits. These rapid test kits can test for COVID-19 faster than the PCR, the polymerase chain reaction test that we have been doing. It's also cheaper. And then, so by the time they roll this out, a lot of people can do what we call some form of mass testing, so that people would know that whether they are positive or negative, so that they can self-isolate. So, and then apart from that, I also understand the federal government is expecting about 30 million doses of Johnson & Johnson vaccine. Now, this one can vaccinate about 30 million people because it's not 2 doses. So Imagine if we are able to vaccinate about 30 million people right now. It should go a long way.
Yeah.
It will help us.
That's great news. All right, let me get a few more questions in for you. Go ahead, okay.
So I wanted to ask you about the numbers. BC reeled out the official statistics. It's not scary at all. And some people would say that the reason that the numbers we have isn't a true reflection of our COVID experience. Do you agree with that? And do you believe that? Because some people will rely on that number and feel, well, it's not that bad. What's your own statement? Do you think we have accurate stats on the number of infections and the number of deaths? And would you say that we should still be very worried concerning COVID?
Oh, yes, we should be very worried concerning COVID, despite the fact that we have a relatively lower number compared to some other countries. Well, we may not say the numbers are correct because, like I always say, right from the beginning of this pandemic, we are not capturing as much as we should. But then again, the number we have is the number we have. It's the data we are working with. And it's not as bad compared to some of the African countries, European countries. It's not as bad. But then again, we cannot defeat COVID until COVID has been defeated all over the world. Because the way it works in public health is that if you still have this pandemic, even in one country, it can spread to other countries of the world.
All right.
So if you still have COVID in Africa, anywhere in Africa, or anywhere in the world, India, for instance, you would agree with me that we have a lot of bilateral relationships with India. We have a lot of heavy Indian presence in Nigeria. So we cannot say it is moving yet, even though our numbers are low, until these other people too also have defeated COVID-19.
All right, fair enough.
You are talking about we are wearing masks. You can go into an organization and they're wearing masks, but if you go to the markets, people have stopped wearing masks. And I think that government has to inform people about this. That is the only way. What is the government doing, the federal government doing about informing? Because you can't just say, I'm locking down your business indefinitely until... because you talked about Europe and America, they are easing lockdown. England has eased lockdown. Shops are open everywhere now. The pubs are allowed to open now. They had it bad. We didn't have it as bad as they had it. And then we are now the ones locking down. While they are opening, we that don't have it. So it's either there is a secret that you people are hiding from us, or you are just locking us down to punish us. Which one is it now?
Well, in all honesty, I don't think there's any secret anywhere. The figures we are seeing is actually the figures that in fact, we have stopped testing in so many of the centers. So if you have stopped testing in so many of the centers, it means that there is no risk as such that will warrant us testing everybody massively. But then again, like I said earlier on, it is not yet in Hulu. We're not recognizing that fact that it is not yet in Hulu. And, well, we have let down our guard, but we decided that they don't want what happened before to happen again. So they decided they want to enforce now. So I think we should just do as much as possible to comply. Well, we know it may be difficult to enforce this face mask wearing of a thing. I really talked about government enforcing it, but obviously it may be very difficult. But then again, the best way we can enforce it is to ensure that institutions, organizations, business owners restrict people from coming to their facilities without wearing face masks. That way, a lot of people will turn out and they will wear their face mask because you know, if you're not wearing your face mask, you're not getting into that bank.
All right.
If you're not wearing your face mask, you're not getting into that health center or that hospital. So that way, you would wear your face mask.
All right, so I'm glad to hear that.
Enforcement.
I'm glad to hear that we're expecting 30 million vaccines, which is great. But for those people who have already taken the first vaccine dose, there was talks about the fact that the second dose might be unavailable for reasons because India, the supplier, was actually restricting bringing these vaccines to the country. Could you confirm if those who have been vaccinated will get their second dose, or it's still a 50-50 situation?
No, I can confirm to you categorically that those who have had the first dose will get their second dose. In fact, very soon for that matter. Arrangement is on. to start the vaccination of the second doses of those who had their first doses. In fact, if it doesn't start this week, I guarantee that we may likely start next week.
Okay.
So there's no doubt about that. The vaccines are still here for those people. They were reserved for them so that they can have their second doses. So that's so.
Thank you very much.
Okay.
All right, we have to wrap up with you. Thank you very much, Dr. Japhet. We always like calling you because, you tell us the truth. So there's no hidden agenda anywhere. No problem. Thank you very much. We'll go on a break. When we come back, move on to another topic. Stay with us. We'll be right back.